Mayor, last night you met with City Council, special council meeting, and you recommended that the City of El Reno make an agreement with SSM, St. Anthony's Hospital, to take over healthcare, becoming like the anchor healthcare provider in El Reno. What was it about St. Anthony's that attracted you to them?
Sure. Last night we did two items. One with the two items we did last night was one with the ambulance service and one with healthcare in El Reno, Oklahoma, like you said, Mr. Dyer. The main thing is what we tried to do is we tried to find what the best fit for us was. We went out for RFPs and we got proposals back. And St. Anthony's had the best proposal to maintain our emergency care that we currently have now at our facility and build a new facility within 24 months that the city will end up owning. We'll have to partner with St. Anthony's. And then they want to keep our emergency room service and bring a doctor's office to our community. So we're real excited about those three.
When you say doctor's office, you mean like another new clinic? Are St. Anthony's looking at bringing maybe more doctors to El Reno?
Yeah, more doctors to El Reno. And what St. Anthony's wanting to do is we're wanting to build a facility. The city of El Reno will build a facility, and that's probably we'll be on the hook for about $9 million. And during the process of this, we've come up with our due diligence and what we've done with the healthcare money that we've received over the years. We got about $4.5 million that we could probably use cash, so we don't have to finance half the building for about 10 years. And the city would own that facility on the 3 or 4 acres, and then right beside it would be another 2 or 3 acres that St. Anthony's would purchase, and that's where their doctors and clinics office would be.
Oh, okay. You also did some work on the ambulance. You recommended, and the council agreed, Pafford Ambulance, and they're out of Arkansas?
Arkansas, Oklahoma. They've been here in Oklahoma since the 50s, different communities. Once again, we received 4 bids, or not bids, 4 requests for proposals. We've received 4 proposals back, and in those proposals, basically Pafford came up with the same level of better than the same level of service we've had. We had 2 ambulances with Mercy, which has done an excellent job for us. We were very pleased with the service they provided. But now Pafford came back with 3 ambulances that's going to be located in our community. And also they're bringing in other ambulances surrounding us to work with our partner cities, Union City, Calumet, Okarche, and Piedmont. And those are the people that we're concerned with also. So it's a lot better deal for us, and then there's a little small price reduction on the services that we've done with them. So they're going to also be incorporated. And what we'd like to do is tie both those together, Pafford and St. Anthony's together, and we're working through the process right now. Basically right now, the council gave me and the staff, Roger Reinhardt and Karen Rieger and Matt Sandage, the authority to go ahead and start the process of getting everything sewed up of what our next steps would be. And what our next steps would be generally is St. Anthony's is going to find the location they want for the medical center. The medical center would include a 24-hour emergency room, just like we have, and a little bit better services than what we currently have. It'll have some beds in there for hopefully we're requesting these beds for observation where you can stay at least a day or 2, no more than that.
How many beds would you like to see?
We'd like to see about 4 or 6, just to kind of maintain kind of what we've been doing. And that level of service basically fits what we're currently servicing right now. It'll help us develop that. The cost on the $4.5 million with the finance, we could do that as a council and add a line item to our water bill for healthcare services, just like other communities do with their ambulance services or drainage. We don't do that. We never have done that in a long time. I think they did it back a lot years and years ago. But the main thing is that money will go directly towards the facility. It won't go for the services. It'll go towards the facility. The city won't run the hospital. The city will own the building. And in that way, we can dictate our healthcare needs the next couple of years. So we think it'll be a small amount on the water bill. We haven't got all the numbers back, but with us having the money cash, the 4.5 to pay basically half the hospital now, we feel in a really good position.
And so the citizens of El Reno will own a hospital building at the end of 10 years. And basically that will be El Reno's skin in the game, is building the building.
That's right, Mr. Dyer. And I think, like you just said, the bottom line is that We'll own a facility in 10 years instead of owning a hospital like we do right now that's 60 years old. Now we'll have one that's been up to date, that's up to standards, and then in 10 years we can do the deal with St. Anthony's or go from there, do something else.
Any ideas what will happen with the existing hospital building?
We don't know yet. I think let's work on the ambulance service like we're doing. Let's work on the emergency room and get these doctors in here and move El Reno forward.
Thank you, Mayor.
Thank you, Mr. Dyer.